The doctors make the worst patients, they say, right?
Oh, yes.
And
Yeah.
treating yourself is not advised.
Oh, I am a terrible patient. I self-doctor. I'm the worst.
Oh, we're
Everyone
guilty.
can
We're all
attest to
guilty
it.
of it.
I had a big funny recently. I was our medical assistant in the clinic in Fair Oaks. We were talking about what a terrible non-compliant patient I was, and I made a joke about, what do you think the Venn diagram of talented doctor versus terrible patient looks like? And she goes, I don't even think there's a diagram. That's just a circle. There's just a full overlap. The better you all are, the worse. So
Yeah, I can see that.
I know. Yeah. Oh gosh, I love that. Jamie, I agree with you. For me, it's about just kind of finding things that keep me grounded. And it's just, and those hobbies kind of will shift, or those interests, but it's about being able to step back and take a breath and come back into my current present, my current body, and where I am. And I find I am the most effective with patients when I've worked on myself so that I can stay grounded for me and for them. Because it's no good for them if they're coming in and I'm already in a heightened state, or I'm preoccupied, or I feel like we said, with what you and I do, it is high level, such that I don't think people should be dabbling in our fields.
Yeah.
I think if you're practicing and you're seeing Lyme patients, that should be pretty much mostly of what you're seeing. Same with oncology. I don't want folks to see practitioners that see a bunch of general care and they've got one or two cancer patients. It's like,
Yeah.
our patients deserve that full focus. So
Yeah, no, I would tend to agree. And I mean, I appreciate people trying to fill the gaps of care, like I said, because there are access issues and everything. But
yes,
yeah, it's that's where we're trying to kind of establish a better collaborative place in our profession at large. And I'll do consults with docs too, and just try to give them some guidance. And
yeah,
if it's too crazy, then they can always come to me or to one of my colleagues, of course. But and so yeah, but I agree with you. Otherwise, it's not necessarily a field of dabbles. It's a little bit more than that. And just like any other specialist, that's what I try to frame this as. Really, is this is all specialty care.
yeah,
So you wouldn't necessarily, do all the work a cardiologist would be doing if there was a heart issue, right?
yeah,
So, but you can collaborate with them, of course, and you can learn from them, and you can integrate some of those things on a local level. Uh,
absolutely.
but you want to have somebody that's really dedicated. I agree.
Yeah, yeah.